Good afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude today is for all those who are caring for vulnerable populations. Workers at our long-term care facilities and nursing homes, nonprofits who serve those most at risk, hospital and medical staff, and all those who have loved ones in a higher risk category. We are grateful for everything you're doing to protect those most at risk. We continue to offer testing to the public on Wednesday and Friday this week in a drive-through model. To reduce wait times, we ask that you call our information line, 215-5555, to be given a time during which you will be tested. As we stated yesterday, we plan to conduct targeted testing on Tuesdays and Thursdays, reaching out to those at risk or those who may not have access to testing otherwise. Moving on to our local situation. We have 301 confirmed cases of COVID-19 in Knoxville. Additionally, we have 5 probable cases. 230 of our cases have recovered. 37 individuals have been hospitalized at some point during their illness, and 2 are currently hospitalized. We are again grateful to report we've had no additional deaths from COVID-19 since our last report. Overall, we're pleased with where we are regarding our local situation, especially when we compare ourselves to some of our counterparts across the state and across the nation. We've had a few clusters, but we've been able to identify them and contain them. The growth rate has been relatively stable, and our hospitals are in good shape. We all want to be able to open more quickly and get back to some semblance of pre-pandemic normal. But a phased, measured approach is the best way to get there in the long run. And I want the community to hear that you've done an excellent job, but it's not over yet. And I want you to continue to do your part to contain the spread. And that includes everybody doing the 5 core actions mentioned in our plan. Adhering to social distancing, wearing face masks, cleaning surfaces frequently, washing your hands, and staying home if you're sick. That will help all of us move forward instead of backward in this phased reopening. And thank you. I want to thank you for everything you're doing. Thank you for the businesses, thanks for the individuals, for everything you're doing to protect and safeguard our communities so that, again, we can move forward and not backward. And now I'll open it up for questions.
Please go ahead and submit your questions into the chat feature. From WBLT, will antibody testing be made available in Knox County?
It is my understanding that there are some antibody tests available for use, but I want to remind everybody antibody testing is not yet ready to be used for patient diagnostics. The testing is not as reliable as we'd like it to be. The gold standard for testing is that's the term we use for the test we prefer everybody get. It's the PCR test, and that's the nasal swab that has to be sent off to a lab. The antibody tests just aren't there yet. We hope they will be soon, but they aren't. So if you get an antibody test, it's not the most reliable test and doesn't give you a whole lot of information about whether you have or don't have disease, whether you're immune or you're not immune.
From the Sentinel, could you please explain what your benchmarks mean by a 3-day shift? Is that a moving average or something else?
I believe it's a rolling average, so it's calculated over time.
Another question from the Sentinel. When you look at a standard deviation between the 3-day shift and the 14 moving average, you are statistically comparing the degree to which those numbers differ, correct?
That is, yes, it's the definition of a standard deviation.
Follow up from the Sentinel. A higher deviation means that the numbers are more different. It's a question. A lower one means they're more similar. Is this kind of thing a standard practice for measuring an outbreak?
Standard deviation is used across epidemiology for measuring differences between numbers and changes in cases.
From WBIR, what would you say to those who are refusing to wear masks? How does that jeopardize the phased reopening plans?
So first of all, wearing a mask is optional. We're not requiring people in the general public to wear masks. There's some industries where we're requiring masks to be worn. Those people who choose not to wear a mask, it's disappointing. We really want everybody to do their part, and they're putting others at risk by not wearing a mask. They're putting our entire community at risk of not moving forward by not wearing a mask.
Go ahead and submit your questions. If you have any questions into the chat feature, please. From WBLT, will businesses who do not comply with social distancing guidelines be subject to any kind of enforcement measures?
So our plan to interface with businesses really includes education, frequent visits, lots of reminders, and things like that to get them to be in compliance. Again, just as the governor has said, we're relying on people to do the right thing and make the right choices to protect themselves, their employees, and our community. And when we go back to the mask, when I wear a mask, I'm protecting you. When you wear a mask, you're protecting me. So let's do that for each other.
From the Sentinel, for case growths in benchmark 1, are those just confirmed cases or is it all cases? The Tennessee State Health Department breaks down both separately.
Okay. Yeah, I think we'll have to follow up on that. Our case report contains confirmed cases.
From WBIR, is the fight against misinformation a bigger fight than the disease?
Wow, that's a great question. The fight against misinformation has been constant throughout this pandemic. And one of the reasons we do these press briefings, so that we can get the correct information out there to our community. And so what I would say about misinformation is what we always say about misinformation. Go to those trusted resources, the CDC, the Tennessee Department of Health, and Knox County Health Department website. All of those are trusted resources to get your information about the pandemic, about what's going on locally. But I'll go back to, COVID-19 is a serious illness. We've been fortunate here in Knox County. Our hospitalizations have been low, our deaths have been low, but we look at other places in the country where hospitalizations and deaths have been very high. So COVID-19 is a very serious illness. So the fight against the illness is also a big challenge for our community and for us.
Please go ahead and submit any further questions into the chat feature. From the Sentinel, you said in your answers to KNS's questions last week that the effective reproduction number for Knox County varies pretty widely based on the model used and that it's not a part of your benchmarking. However, during an earlier press conference during which the planning for phased reopening was announced, a low reproduction number was referenced by Dr. Buchanan. Could you clarify this?
Wow, it's a great question. I don't have memories back to every press conference we've had. Again, we're really not using those models as part of our benchmarking. Models are not made for benchmarking. They're made for predicting. Benchmarks are things that we meet and we go, we met those and we're going to move forward. And that's what a benchmark is. A model is a model that predicts what's going to happen, not meant for benchmarking at all.
His follow-up question is, why reference that if it wasn't part of the decision-making?
It was part of the information we had, and we did use the information that we had to help make decisions. So I didn't say we wouldn't use them for decision-making. I said we'd use them for benchmarking. So we used models to help us make decisions, but we're not using them in benchmarking.
All right, and I think that answers your second question there, Vincent. If it doesn't, please type another question in there, please. Any other further questions? Please go ahead and submit them into the chat feature now. I see where you say see above, Vincent. I'm confused to which question you're saying to see above to. If you don't mind typing it out one more time, that'd be helpful. From WVLT, does Knox County have any concerns about supply of remdesivir?
I am not. So first of all, remdesivir is all very new, will be used in very limited ways in studies that are ongoing, I believe. We do not have any information on supply of remdesivir locally or nationally at this time.
Okay, here comes the question from the Sentinel. Could you please tell us how you calculate R, effective transmission, and what it is locally?
We have not been calculating the R value. What we're looking at is real-time data and how our cases our case rate, our growth rate is remaining very steady outside these two clusters that we've had. And that tells us that our growth rate is not increasing, it's staying steady, and that's what we want to see.
Any further questions? Please go ahead and submit them now. Sentinel says, thank you for tolerating all the staff's questions. All right, I see a couple
Sure.
thank yous in there, so I assume that's all the questions for today. Thank you all for joining us, and we'll be back with you tomorrow at 12:30.